Welcome back. According to research by Priceless South Africa, there is no correlation between the Health Promotion Levy and job losses in the sugar sector. Now, the SA Canegrowers Association has been quoted in the report as claiming that job losses are directly linked to the sugar tax. But according to a new study, this is actually due to the COVID-19 pandemic. Let's discuss this further. We're joined by Dr Chengetai Dare. He is a senior health economist at Priceless South Africa. Dr. Dare, it's great to have you with us on the program. Thanks very much indeed for coming on. I must say it does make sense in a way for the cane growers to claim that the sugar tax has had some impact in terms of job losses in the sector, but that's actually not what you found.
Thank you, Chengetai, for having me. So, let me start off by highlighting that we did a study where we investigated the relationship between the HPL, which is the sugar tax, how it is related to employment, specifically in the sugar industry. Our findings has pointed to the fact that there's no association at all between the HPL and job losses in South Africa. So in other words, the HPL did not promote the generation of employment, neither did it reduce the employment levels. So that's the correct position from our standpoint.
And how was your research conducted? How do you determine that actually it's something like the COVID-19 pandemic that is to blame?
Okay, so what we did is we used data from the Quota Labor Force Survey, which is collected by the Stats SA, and that data is in public domain and it's actually independent. Independent in the sense that the survey was not conducted by any people who have got some vested interest, so to say. So in this case, we used that data set and employed a single group interrupted time series analysis to try and now investigate the impact of HPL on employment. So you realize that we looked for the period between 2008 to 2023, which is enough period to do the investigation. So now, we also controlled for COVID-19. And the good thing with that is that we actually we even went further to compare the sugar industry versus the non-sugar industry. And basically, there's no relationship. So the decline, actually, if you are to look at the trend, you realize that there is actually a steady increase in employment levels in the sugar industry. But the sharp drop actually occurred during on the onset of COVID-19. But again, soon after, 2 quarters thereafter, actually, we see that there's a recovery in terms of employment in the sugar industry.
Yeah.
So,
go ahead.
So we can't attribute the HPL to any decline in the employment levels in the sugar industry, but we can actually attribute that to COVID-19. That is post the first quarter of 2020.
So Dr. Dare, the premise, as we know, of the sugar tax was to curb sugar consumption. And studies have shown that there's been quite a positive uptake of this kind of initiative. We've seen a decline in just how much sugar people are consuming. And it's an important thing for a country that is struggling with rising obesity levels. Of course, we've got rising chronic levels of chronic diseases like diabetes and high blood pressure as well. But are you saying that you want the sugar tax to go even further than just sugary drinks like Coca-Cola, like Pepsi, like the popular ones that come to mind?
Exactly. So, based on our findings, considering that the HPL does not impede employment and that there's overwhelming evidence on the effectiveness of the sugar tax, together with its relatively low burden, because it's actually the tax burden, which is in this case the share of the HPL to the retail price, you realize that the current tax burden is 8% of the retail price, which is far below the 20% minimum threshold that is recommended by the WHO, which is the World Health Organization. So based on that premise, we actually would advise the government to consider expanding the HPL to also include fruit juices, and also perhaps increase even the threshold from the 4 gram per 100 meals to higher rates. And actually, I can even make it clear to say that there's overwhelming evidence that is shown that including fruit juices into the HPL tax base would actually affect 157 incident cases of type 2 diabetes over the next 20 years, which of course is a plus to the society. And also, based on that notion to include the fruit juice in the HPO tax base, you realize that there's also improved health, which is actually a result of the affected incidence and death. And this will actually reduce the overall health care expenditure by over 7.5 billion over the next it will reduce the expenditure by over 7.5 billion rands over the next 20 years, which is a plus.
Yes. And you're talking about the burden insofar as those chronic diseases are concerned. Dr. Chengetai Dare, let me thank you for your time this afternoon, a senior health economist at Priceless South Africa. Very interesting indeed, the SA Canegrowers CEO saying that it still stands by the figure of 16,000 job losses. And it was, they say those jobs were shed on sugarcane farms after the Health Promotion Levy was implemented. And I believe it was implemented back in 2018. So interesting to see that they're still sticking to those numbers.